I would like to express my great appreciation to inviting me to such conference, because it is so important to be in this transitional period of time, to be with activists and some few doctors who were in audience of this seminar. And the majority of doctors are continue to have a very reluctant, over-conservative attitude toward the cannabis. But maybe they just do not have enough information. Nobody explained them that it is going to be part of their practice in the further years. So we should create some relevance to this topic, some reasons to doctors to participate in educational programs, to explain them that it's probably going to be part of our regular medicine armamentarium. And this is why doctors should understand that they will be questioned by their patients. They should be ready to answer the question, not to say it is drug for abuse, it is dangerous drug, now it is unacceptable. And doctor is going to understand it. This is why it's very unfortunate they are not participating, but maybe they were not informed on the way they are ready to be informed, that the participation in such educational meetings could increase their level of knowledge, their level of professional superiority. We should create incentives for the doctors to go further, to improve themselves. My main task, my main aim as a chairman of a task force of International Association of Cannabinoid Medicine, to create doctor awareness to continue medical education, to continue professional education, to learn more about cannabinoid system, how to use cannabis for our patients. And we are ready to provide any kind of commentary and some consulting work with the doctors under the invitations of hospitals, governments, etc.
Okay, thank you.